Despite this Supreme Court justice actually spreading misinformation, outright lies, the Supreme Court blocks Biden COVID vaccine mandates for businesses. But the ruling falls short of protecting healthcare workers' rights. In dissent, Justice Samuel Alito writes, "I do not think that the federal government is likely to be able to show that Congress has authorized the unprecedented step of compelling over 10 million healthcare workers to be vaccinated on pain of being fired." Bringing you what's ignored, sensationalized, unbalanced, misleading, or just plain false. Here's your media malfeasance for the second week of January. COVID conspiracies come true. The narrative is crumbling. Here's something censored docs have been warning about since the beginning: the potential for repeated jabs to hurt the immune system. From Bloomberg, repeat booster doses every 4 months could eventually weaken the immune response and tire out people, according to the European Medicines Agency. And as if we haven't heard it enough, the WHO Europe posted most people, a very scientific number, have mild or no side effects after the jab. But it was met with tens of thousands of personal stories of people experiencing severe reactions or losing loved ones after they were given the shot. Something apparent in the vaccine adverse event reporting system that Dr. Fauci and CDC Director Walensky refused to acknowledge or attempt to downplay. When confronted with the over 20,000 deaths reported, they have this to say.
So if you get hit by a car tragically after getting vaccinated, that gets reported in the vaccine adverse reporting system, the VAERS system. So the vaccines are incredibly safe.
Wait a minute, then why was it okay to count those kinds of deaths as COVID deaths? Never mind, this comment is extremely misleading. VAERS doesn't have a symptom that is called road traffic accident. But here's an example of how a traffic accident could be the result of COVID vax complications. From VAERS. She was released on 1/27/21 and was driving on 1/28/21 around 4:15 p.m. and appears to have had heart failure and had a wreck. She passed away that day. Is it any coincidence that heart problems have been listed as possible side effects of the jab? Or how about that VAERS describes itself as early warning system to detect possible safety problems? VAERS is reporting more than 21,000 deaths following the emergency use authorized COVID-19 vaccines for the first year, which is more deaths than following all FDA-approved vaccines for the past 31 years combined, since VAERS started recording deaths following vaccines in 1990. Should this, at minimum, be a safety signal, a huge red flag? And websites went wild when this clip of Walensky on GMA made its rounds.
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with.
A point many have been making that could be skewing the numbers. But then damage control. MSM says she was taken out of context. The 75% who had 4 comorbidities or more were out of those who were vaccinated that died. In that case, we'll acknowledge comorbidities because science. So where is the data that acknowledges this factor overall? According to the Dispatch, the latest provisional data from the CDC shows that 95% of individuals with COVID listed on their death certificate had at least one underlying risk factor. Walensky's spokesperson did not respond to a request for information on what percent of the general and unvaccinated population who passed away had 4 or more comorbidities. Speaking of Walensky twisting the truth with next to nil accountability, the CDC director continues to repeat a flawed mask study in support of requiring masks in schools. This study came under fire by The Atlantic, who criticized several flaws within the methodology, which among other things included 40 virtual learning academies. The CDC has also come under fire for shifting its recommendations regarding testing and quarantining. And as for clarification on the accuracy of the death numbers,
do you know how many of the 836,000 deaths in the U.S. linked to COVID are from COVID, or how many are with COVID, but they had other comorbidities? Do you have that breakdown?
Yes, of course. With Omicron, we're following that very carefully. Our death registry, of course, takes a few weeks to collect. And of course, Omicron has just been with us for a few weeks, but those data will be forthcoming.
Never mind deaths that might have been prevented with early intervention. The Project Veritas bombshell this week exposed leaked military documents showing ivermectin works throughout all phases of COVID. So why has the medical establishment suppressed it for 2 years? And the legacy media following in lockstep. Oh, and another one of those crazy conspiracy theories that the COVID-19 jab can affect menstruation. Except, oh wait, now a study shows that it can. Is it really such a leap then that if it affects menstruation, it can affect reproduction? And while the study and articles downplay the effects, again, just take a look at the comments. Real women sharing their personal stories. But even as we've all witnessed the flip-flopping and the things that some doctors told us was misinformation, now confirmed true by studies months later, some doctors are demanding no dissent allowed. 270 doctors signed an open letter calling for Spotify to drop their most lucrative contributor for daring to let other doctors and experts share their theories and data. Meanwhile, more than 13,000 doctors from across the globe have signed a declaration against mandates, lockdowns, and injecting healthy children. And did you happen to miss the mass formation meltdown? AP, Reuters, and others all acting in unison to try to fact-check a theory that has been studied for over 200 years. Matthias Desmet, a professor of clinical psychology, says there are 4 conditions that are needed for large-scale mass formation. Conditions we've seen play out before our own eyes. So we're ready. Take a cue from Germany's top newspaper apologizing for the outlet's fear-driven COVID coverage, or a Danish newspaper that's publicly apologized for reporting government narratives surrounding the COVID-19 pandemic without questioning them. We're ready for our apology. Or just admit what's really happening. He's been asking for it.
I make a special appeal to social media companies and media outlets. Please deal with the misinformation and disinformation that's on your shows. It has to stop.
Just admit your state-controlled media. Holding them accountable, I'm Kristi Leigh.